NEET PGയിൽ All India 50th rank ആയിരുന്നു. What actually made you choose abroad to be a oncologist and not India?
I didn't want to come back here. ഇന്നൊക്കെ ഒരുപാട് ഡോക്ടേഴ്സ് ഉണ്ടല്ലോ, അന്നധികം ഡോക്ടേഴ്സ് അല്ല.
Oncology is a department which has got an emotional weightage, right? ഒരാൾക്ക് ക്യാൻസർ ഉണ്ട് എന്ന് പറയുന്നത് വളരെ സങ്കടമുള്ള ഒരു കാര്യമാണ്. How do you deal with it?
But in medicine, there is no shortcut. I was not even planning to be a doctor actually.
Responsibilities മാറാണ്, mindset മാറാണ്, outlook of life തന്നെ മാറാണ്. A young doctor want to move abroad. Maybe MBBS complete ചെയ്തു അല്ലെങ്കിൽ MBBS MD complete ചെയ്തു. What is your advice towards them?
Who can make such a big life and death decision for you?
ഒരു ക്യാൻസർ പേഷ്യന്റിനെ ക്യാൻസർ സർവൈവർ ആയി കാണുന്നതാണ് ഏറ്റവും റിവാർഡിംഗ് ആയിട്ടുള്ള ഭാഗം.
Yes. I mean, a significant number of the patients we see long term are cancer survivors.
Health care system in India കുറിച്ച് എല്ലാവർക്കും നമസ്കാരം. വെൽക്കം ടു അനദർ എപ്പിസോഡ് ഓഫ് ഹ്യൂമൻസ് ഓഫ് ഹെൽത്ത് കെയർ. ദിസ് ഇസ് രാധിക ഡിജു, മെഡിക്കൽ സ്റ്റുഡൻറ്, കാലിക്കറ്റ് മെഡിക്കൽ കോളേജ്. ഇന്നത്തെ പോഡ്കാസ്റ്റ് വളരെ സ്പെഷ്യലാണ്, കാരണം വളരെ എക്സെപ്ഷണൽ ആയിട്ടുള്ള ഒരു ഗസ്റ്റ് ആണ് ഇന്ന് എൻ്റെ കൂടെ ഉള്ളത്. ഞാൻ പൊതുവേ പോഡ്കാസ്റ്റിന് ഇങ്ങനെ ഐപാഡൊന്നും പിടിച്ചിരിക്കാറില്ല, പക്ഷേ ഈ ഒരു ഗസ്റ്റിൻ്റെ അച്ചീവ്മെൻറ്റ്സ്, അവാർഡ്സ്, സർട്ടിഫിക്കറ്റ്സ്, റിസർച്ച് ആക്ടിവിറ്റീസ് പറയണമെങ്കിൽ നമുക്ക് ഒരു എക്സ്ട്രാ എപ്പിസോഡ് തന്നെ വേണ്ടി വരും. എനിവേ, ഇതിൽ തന്നെ ഏറ്റവും കൂടുതൽ അട്രാക്ട് ചെയ്ത കുറച്ച് കാര്യങ്ങൾ ഞാൻ പറയാം. ഹി കംപ്ലീറ്റഡ് ഹിസ് MBBS ഫ്രം കാലിക്കറ്റ് മെഡിക്കൽ കോളേജ്, 30th ബാച്ച് ആയിരുന്നു. അതിനുശേഷം MD മുംബൈയിൽ നിന്ന് കംപ്ലീറ്റ് ചെയ്തു. NEET PGയിൽ All India 50th റാങ്ക് ആയിരുന്നു. അതേപോലെ തന്നെ MD റേഡിയോളജിയിൽ റാങ്ക് 1 ആയിരുന്നു. അതിനുശേഷം പിന്നെ US മൂവ് ചെയ്തു, അവിടെ സെറ്റിൽ ചെയ്തു. ആൻഡ് ഹി വാസ് എലക്റ്റഡ് മൾട്ടിപ്പിൾ ടൈംസ് ആസ് ദ ബെസ്റ്റ് അമേരിക്കൻ ഓങ്കോളജിസ്റ്റ്. യെസ്, ഐ ഹാവ് വിത്ത് മീ ഡോക്ടർ ഖലീൽ അഷ്റഫ്. വെൽക്കം സർ.
Thank you. That was a very kind introduction.
First of all, thank you so much for coming. വളരെ കുറച്ച് ദിവസങ്ങളേ ഉള്ളായിരുന്നു, ബട്ട് വെൻ ഐ അപ്രോച്ച്ഡ് യു, യു വർ സോ വെൽക്കമിങ്. സോ ആദ്യം തന്നെ സാറിൻ്റെ അടുത്തേക്ക് ചോദിക്കാനുള്ളത്, എങ്ങനെയാണ് MBBS എത്തിപ്പെട്ടത്? എങ്ങനെയാണ് മെഡിസിൻ എന്നുള്ള ആ ഒരു ട്രാക്കിലേക്ക് വന്നത്? പണ്ട് തൊട്ടേയുള്ള സ്വപ്നമായിരുന്നോ?
ഇറ്റ്സ് ഇൻട്രസ്റ്റിംഗ്. കാരണം നമ്മൾ പലപ്പോഴും നമ്മുടെ ഡിസിഷൻസ് ആൻഡ് ഓൾ ആർ റാൻഡം. എൻ്റെ ഫാമിലി, ഐ തിങ്ക് ദേ ഓൾവേസ് വാണ്ടഡ് മീ ടു ബി എ ഡോക്ടർ. കാരണം അത് അന്ന് നമ്മൾ പഠിക്കുന്ന സമയത്തൊക്കെ ഒരുവിധം നല്ല പഠിക്കുന്ന കുട്ടികളാണെങ്കിൽ ഒന്നുകിൽ ഡോക്ടർ, എൻജിനീയർ, അങ്ങനെയായിരുന്നു. ഇപ്പോഴൊക്കെ ദർ ഇസ് ഫാർ മോർ ഓപ്പർച്യൂണിറ്റീസ്. സോ പക്ഷേ എനിക്ക് ഐ ലൈക്ക് മെഡിസിൻ, ബട്ട് ഐ വാസ് ബെറ്റർ ഇൻ മാത്ത് ആൻഡ് ഫിസിക്സ്. അപ്പം ഞാൻ ഫറൂഖ് കോളേജിലാണ് ഞാൻ പ്രീ ഡിഗ്രി ചെയ്തത്. സോ വെൻ ഐ ആക്ച്വലി ജോയിൻ ഫോർ ഫസ്റ്റ് ഗ്രൂപ്പ്, നോട്ട് സെക്കൻഡ്. അന്ന് ഫസ്റ്റ് ഗ്രൂപ്പ് എന്ന് പറഞ്ഞാൽ you want to become an engineer.
Okay.
And second group ആണ് zoology.
You were a brilliant student from the very beginning.
I don't know about that. I mean, I was a reasonably okay student. But anyway, so I joined first group, not second. So at that time, I was like 15. അന്ന് വലിയ ഐഡിയ ഒന്നുമില്ല, പക്ഷേ ഡീപ് ഡൗൺ I was thinking I should be doing engineering. അത് കാരണമാണ് ഫസ്റ്റ് ഗ്രൂപ്പ് ചേഞ്ച് ചെയ്തത്. ഫറൂഖ് കോളേജിൽ പോയപ്പം all my best friends, this is how I was telling you, how small decisions turn big in the long run. So all my best friends turned out to be in second group. So I changed to second group.
Okay.
So if I tell you that I had this huge big goal when I was 15 to be a doctor. So annu you may not understand this. Annu pre-degree ennu parna oru idund. This is far long time ago. So after your school you go to a college. Now I think it's all together.
Yes.
അപ്പോൾ അന്ന് 10th കഴിഞ്ഞിട്ട് നമ്മൾ പോയപ്പോൾ so again that's how I ended up in second group. And once in second group, then I said, okay, now I want to be a doctor. So it's not a very dramatic story. So, and of course I had some role model. എൻ്റെ ഫാമിലിയിൽ തന്നെ എൻ്റെ ഫാദറിൻ്റെ അനിയൻ ഡോക്ടർ ഖാദർ, he is one of the first doctors from നമ്മുടെ entire and probably entire താലൂക്ക്. ഇന്നൊക്കെ ഒരുപാട് ഡോക്ടേഴ്സ് ഉണ്ടല്ലോ, അന്നധികം ഡോക്ടേഴ്സ് അല്ല. So I always looked up to him, so I did have a role model. And so somewhere along the line I thought this is a good thing to be.
Okay. സാറിൻ്റെ MBBS ലൈഫിനെ കുറിച്ച് കുറച്ച് നമുക്ക് ഷെയർ ചെയ്യാൻ പറ്റുമോ? ഗ്ലിംസസ് ഓഫ് യുവർ MBBS ലൈഫ്, സം മെമ്മറീസ്, മേ ബി അബൌട്ട് യുവർ ഫ്രണ്ട്സ്.
MBBS was a sudden change. കാരണം നമ്മൾ പ്രീ ഡിഗ്രി വരെ ഇപ്പം you would understand this very well. നമ്മൾ pre-degree 12th വരെ you know every subject completely, right? If you're a good student, you finish all your chemistry, you finish all your biology, you finish your botany, you finish your physics, there is like hardly there is nothing you don't read, right? The textbooks are this small, and
We get the time to revise.
yeah, you
as
get to
well.
revise. The textbooks are this small, and then you go to medical college, and you're like, suddenly you find these things that you first time you realize you can't finish a subject. Like you can only like
Vastness of that syllabus hits
vastness.
you.
Yeah, the vastness suddenly hits you, especially people who are, you know, who are like, you want to know everything. Like in medicine, this is so vast. So the vastness was like kind of shocking, and then I mean, exams after exams, I think it's probably still the same, averages. So it's a very busy life. Most non-physicians won't understand it, the amount of time you have to spend, the amount of like late nights, sleeplessness. And the other thing with medicine is you can't make up for hard work by brilliance. Like, if you're doing physics or math or engineering, I think you can get away if you know the subject, like without like really like studying a lot. But in medicine, there is no shortcuts. I mean,
Shortcuts
it's
illa.
not. It's a tough field too, but it's rewarding. You build the best friendships there, and some of the best memories. And I met my wife there, so a lot of
Same
good
batch.
memories. Actually, same batch, yes.
ഓക്കെ.
Yeah.
MBBS ലൈഫിൽ സർ ഇപ്പോഴും ഓർത്ത് വെക്കുന്ന എന്തെങ്കിലും ഒരു ഇൻസിഡന്റ് ഉണ്ടോ? മേ ബി സംതിങ് യുവർ പ്രൊഫസർ ടോൾഡ് ഓർ എനിത്തിങ്.
We had amazing professors, and our batch was very lucky that we had a lot of VIP students. In the sense, a lot of students who are children of some of the big professors. So our batch was
Privileged.
privileged. We were well taken care of. So we had a lot of senior professors kids were in our class.
Okay.
So that was I think good. And also some of the best teachers I ever had was in medical school. Like, CBC sir, he is no more. He was my medicines teacher. Salim sir, who is still alive, as you know, he's around. He's actually one of the inspiration, I would say. He's a hematologist, oncologist, one of the first in the state. So these were all real role models. A lot of them, I don't want to name names because I would think majority of them made a significant difference. In those days, unlike now, you can just Google or, look up stuff. What they told us was like, that was it. And education and the teaching, summarizing these vast subjects, it really helped us to be who we are now. So CBCs are especially, I was like, I really looked up to him.
They have influenced you so much.
Significantly, yes. He always used to say, don't treat, the patient as a disease, to treat the patient as the whole human being. Because, disease don't exist in a vacuum, right? You see this, right? You can have two patients with the same exact disease, have completely different outcomes. രണ്ടുപേരുടെയും കാരണം, this disease is just part of the whole process. So that is a big thing that I still remember, him telling that, just don't treat the disease, because patients sometimes when students and house surgeons present cases, they focus on either pneumonia patient, but pneumonia patient എന്ന് പറയുമ്പം that pneumonia becomes the thing. That is just one of the main things about the patient. So that was a
പേഷ്യന്റിന് ഇമ്പോർട്ടൻസ് കൊടുത്തിട്ട്.
patient as a whole is the right. You can't just treat the pneumonia without knowing, where does they live, like what is the social situation, that kind of aspects. It's, I think, really helpful.
ഓക്കെ. MBBS ശേഷം സർ പിന്നെ നീറ്റ് PG എഴുതി. യു ഗോട്ട് ആൻ അമേസിംഗ് റാങ്ക്. 50 ആയിരുന്നു ഓൾ ഇന്ത്യ റാങ്ക്. വാട്ട് മേഡ് യു ചൂസ് മുംബൈ? ഗ്രാൻഡ് മെഡിക്കൽ കോളേജിൽ എങ്ങനെയാണ് എത്തിപ്പെടുന്നത്?
Actually, I joined Zipmer for a short time before that.
Oh.
But anyway, so for at that time, those days, again, just like my confusion about first group versus second group, I was not really sure what PG to take. And one of the senior Krishnadas, he is actually at I think Sri Chitra now. He's a smart, brilliant guy. He's the first person I saw who took radiology. This was just coming up at that time.
Okay.
And then I looked up, and it seems like a nice field because I'm a visual person. I'm not very good at hearing, and I was like, I'm never going to be a cardiologist. So I can't hear well, or I'm not very good at murmurs and stuff. So I was like thinking maybe I'm a good visual person, so I should do radiology.
Okay.
And then for radiology, JJ Grand Medical College was one of the best centers, and that's why I opted for Grand Medical College.
Okay,
Yeah.
so how different was your PG days from your MBBS days? Responsibilities മാറാണ്, മൈൻഡ് സെറ്റ് മാറാണ്, ഔട്ട്ലുക്ക് ഓഫ് ലൈഫ് തന്നെ മാറാണ്. അപ്പോൾ അത് എന്തായിരുന്നു സാറിന് ഫീൽ ചെയ്തൊരു ഡിഫറൻസ്?
You suddenly feel like you have grown up. You feel like you have become like a real doctor.
Okay.
In this, not a real doctor in the sense, I mean, you as a student, you are always kind of feel protected, like medicine.
Yes.
Outside Kerala, അന്ന് കേരളത്തിൽ PG ചെയ്യുമ്പം it was a little bit milder in the sense you are still a student, whereas outside, especially Bombay and all, when I did my MD there, you are like a really a full-time doctor in the sense you are the person running the place. You soon after you join, you are the junior resident, the senior resident, you are reading the scans, you are doing the procedures, you have very little supervision. I mean, you do have supervision, but not in the middle of the night. Like if you get a phone call in the middle of the night, someone comes with a trauma, you are the one actually going there doing the scan, so you are much more independent. So it was a sudden change from being kind of a student, even though a hardworking or very like overworked student, but now you are like actually doing like feeling like a real doctor.
ഓക്കെ. ഇതിനുശേഷം പിന്നെ എപ്പോഴാണ് ഓങ്കോളജിയിൽ സ്പെഷ്യലൈസ് ചെയ്യണം എന്നുള്ള ഡിസിഷനിലേക്ക് വരുന്നത്?
That's another, so my story, as you can see, like I have multiple chapters in my life. So after my MD, I got married, and she is from my batch. Okay. Actually, she works in the same town as I am right now. She is a pediatric endocrinologist. So anyway, after we finished my MD, I got a job immediately in Saudi.
Okay.
As a radiologist. In those days, you didn't innatha mari bond, there was nothing like that. So we immediately left, and so I was working as a radiologist, and she was working as a pediatrician. So the first time after working as a radiologist, I realized I really miss patient care. Like during residency, I never felt that way because you were actually also taking care of patients. It was much more clinical, at least our residency in Bombay. Whereas in actual work as a radiologist, I was just sitting in a dark room and reading scans, and I do like people. I do like patient interactions. So then I kind of had a rethinking about what am I doing. So by the way, I had given my USMLE while I was doing my MD. Okay. At Bombay, but I had not applied anything. I just finished my MLA. And then when I was doing the radiology, I was thinking maybe I should change my track to something more clinical. And that's when I started looking at again, USMLA, I just wrote the exam. I didn't really, was not planning anything. A lot of my decisions are kind of, as you can imagine, as you might have already guessed, it's not like with a lot of forethoughts or planning. But anyway, I just did the MLA just in case. And then when I went to Saudi, I thought I am going to change to medicine. And that's the time, around the same time, my uncle, one of my favorite uncles, he developed a pancreatic insulinoma. Oh. Yeah. So, and as a radiologist, I was able to kind of give him some directions, but I felt like not like a complete doctor, so to speak. And okay. Then I was thinking, and he was very influential when I was growing up. So that's the first time I actually started seriously thinking about oncology. So to do oncology, you had to do medicine. So I applied for medicine and got into medicine, and then I did oncology after that.
Okay. Yeah. Oncology is a department which has got an emotional weightage, right? ഒരാൾക്ക് ക്യാൻസർ ഉണ്ട് എന്ന് പറയുന്നത് വളരെ സങ്കടമുള്ള ഒരു കാര്യമാണ്. ബട്ട് സാറിന്റെ കേസിൽ അതാണ് സാറിന് പറയാനേ ഉള്ളൂ. അപ്പം ഹൗ ഡു യു ഡീൽ വിത്ത് ദറ്റ്, ആ ഇമോഷണൽ വെയിറ്റേജ്, അതേപോലെ വാട്ട് പ്രിക്കോഷൻസ് ഡു യു ടേക്ക് വൈൽ സ്പീക്കിംഗ് ടു യുവർ പേഷ്യൻസ്, വൈൽ ബ്രേക്കിംഗ് ഡൗൺ എ ബാഡ് ന്യൂസ്?
Sure. I mean, it's never easy. If I tell you, is very easy. That's not true. It is always difficult, right? I mean, as far as a patient is concerned, a cancer patient is concerned, that is probably the worst news ever that person has gone through. I mean, the worst thing a person can hear,
Yes.
right? So, so it has to be, it is always something you don't rush. Whenever I have new patients, that's one advantage we have. At least we have time. I can't imagine how to do it when you have maybe 50 patients a day. But we have time. When you have new patients, we have plenty of time to, go through the diagnosis. And thankfully, as you know very well, oncology has come a long way. We have probably made more advances in oncology than in any other field. നമ്മുടെ genome project ഒക്കെ, I think that has probably made more advances in oncology than any field. So, except in occasional cases like advanced pancreatic cancer or pancreatic biliary or some glioblastoma of the brain, some exceptional tumors, still it's a hard news. There is really, there's no way to sugarcoat it. And in those cases, I do tell them the upfront. I mean, that I don't sugarcoat the news. I tell them the way it is. But thankfully, like I said, if it is breast cancer or prostate or leukemia or lymphoma, even advanced disease, we have very good success rate. So I focus on that aspect. That it is hard. It is going through, chemotherapy and all is not difficult. I mean, it is not easy. But at the end of the day, there is, light at the end of the tunnel. We can get you through this. We can help you live longer. And frankly, I would say nearly a significant number of the patients we see long term are cancer survivors. I mean, it's not every patient I see is a new cancer patient, right? We have plenty of cancer survivors. And we have a program in our department where we have our cancer survivors, they want to volunteer. And we tell them, we have the new patient actually talk to these volunteers who are patients who had gone through the same thing. So that actually probably helped them more than anything I can tell them, to be honest, right? I mean, they hear from me, they ask me all the medical, scientific, all that treatment related questions. But when they have more like emotional aspects and those things, the survivors talking to the new patients, I think would be that really helps them, and we get a lot of feedback on that.
Okay.
Hearing it from a patient who went through this and is doing well now, right? That is probably more impactful too.
Okay, actually, that was my next question. What is the most rewarding part of being an oncologist? And you just said now, ഒരു ക്യാൻസർ പേഷ്യന്റിനെ ക്യാൻസർ സർവൈവറായി കാണുന്നതാണ് ഏറ്റവും റിവാർഡിംഗ് ആയിട്ടുള്ള ഭാഗം.
Yes, and also patients responding. Thankfully, with my radiology training, I have a PAC system in my office, and it is like some diseases you see the responses like say lymphoma and all. If you do a PET scan before and after PET scan, you can tell the patient the PET scan looks better, or you can show them the actual PET scan. It can be very impressive. You don't need to do any radiology because it's all very obvious. As if you have seen PET scans, this is very obvious. You have these areas that are so bright and large and abnormal, and then there is a PET scan that looks normal, and anyone can look at it and they can get that visual satisfaction, and that is that you can kind of partake in their joy in that.
It's very rewarding.
Very rewarding. I think oncology, more people who don't realize or have not rotated through oncology think it is depressing, but in my opinion, oncology is probably the most optimistic and positive field. Actually, we have the same concept from students in US also. They come to us thinking that this is going to be a very depressing rotation, and they end up saying this is probably the most rewarding rotation they had. I mean, you're taking a patient who are near death or like going to die within few months, and you can cure them. That's such a blessing. Yeah.
Okay.
Yeah.
What actually made you choose abroad to be a oncologist?
Yeah.
And not India?
Well, I mean, of course, like I didn't want to come back here and then do medicine. It will be kind of strains.
Okay.
And I already had my USMLE, and some of my friends by that time had already gone to US. And so I was like, okay, so let's go to US. And I did at that time, oncology has come a long way in India. But this is many decades. I mean, it's before 2000, right? 99. Oncology was just beginning here. Actually, most oncology was managed by radiation oncologists.
Okay.
Medical oncology was just beginning as a specialty here. So I was, I was not sure, I want to get trained here. So, and I knew US at that time was doing really well. So in terms of oncology, and decided to go there.
ഓക്കെ. അപ്പോൾ ഒരു ഇമിഗ്രന്റ് ഡോക്ടറായി അവിടെ പോയ ടൈമിലുള്ള ഇനീഷ്യൽ എക്സ്പീരിയൻസ് എങ്ങനെയായിരുന്നു?
Yeah. Well, thankfully I went to New York.
Okay.
And New York is a completely immigrant city. I can tell you, the third day in New York, someone was asking me the directions. It's like I look like any other person there. So in New York, you don't feel really like a foreigner. Like in Saudi, I felt like a foreigner. So it was easy. New York was easy. And one good thing about US for doctors is 1 in 7 doctors in US is an Indian.
Oh.
So even in TV serials, if they want to show a doctor, it'll be an Indian, because it is like kind of like it's kind of a given for patients expecting an Indian doctor. It's not at all shocking to them. So there was no issues like that.
Okay.
So I don't think I ever had a kind of a difficult immigrant type difficulty as a doctor there. Only difficulty is like in the visa offices. In the beginning stage, you have to apply for this visa, and you're always not sure what will happen. You have this random person who can make such a big life and death decision for you. He is, not the person who is qualified to assist you as a doctor or anything, but they could make a random decision. That was always stressful. But once you were there, it was fairly okay.
So sir, was there a point where you doubted your decision? You felt like ഇന്ത്യയിൽ തന്നെ നിന്നാ മതിയായിരുന്നു, അങ്ങനെ തോന്നിയിട്ടുണ്ടോ എപ്പോഴെങ്കിലും?
ഇന്ത്യയിൽ I mean, not for working, but you, of course, you miss things, right?
Yeah.
You miss family, and you miss functions.
Yeah,
and
I was talking about that
yes.
stage of loneliness.
Yes,
was there?
Yes.
Okay.
I mean, of course, like we have our own community back there. There's always, every town has Indian community, Malayali community. We have our own Malayali community, and Onam and Christmas, and we do all that big way. But still, you do miss home. Yes, nostalgia is, I guess.
Was that the biggest sacrifice you did while moving abroad?
I think so, definitely. Losing family, or like not able to see them, not being part of, a lot of what is happening around here, and weddings and all that stuff.
ഓക്കെ. സാറിനിപ്പം ഹെൽത്ത് കെയർ സിസ്റ്റം ഇൻ ഇന്ത്യനെ കുറിച്ച് എന്തായാലും MD കാര്യങ്ങൾ ഇവിടെ ചെയ്തത് കൊണ്ട് ഒരു ഐഡിയ ഉണ്ട്. ഏറ്റവും കൂടുതൽ സാർ വർക്ക് ചെയ്തിട്ടുള്ളത് എബ്രോഡുമാണ്. ഒരു ഡിഫറൻസ് ഞാൻ ചോദിക്കുകയാണെങ്കിൽ ആദ്യം തന്നെ മൈൻഡിൽ എന്താ വരുന്നത്?
Well, the US, India system, I am quite outdated. Because my training was many decades ago. So, but one thing I found is like with minimal resources, we do amazing medicine here.
Yes.
With the limited resources, we have more variety of cases, and the clinicians here are exceptionally good, because you make up for the lack of technology and all. So, so there is that lack of resources, patients resources. Pinna namukku patient. But if you want to, that's another thing I feel like I don't know how I will be able to practice in Kerala. നമുക്കൊരു ക്യാൻസർ പേഷ്യൻറ്റ് അവിടെ ചികിത്സ കൊടുക്കണം എന്ന് പറഞ്ഞാൽ majority of the time there is no issue. Patient doesn't have to pay a lot, right? There is insurance, it's covered. I don't even know the cost of many drugs. In fact, one of the leukemia drugs, one of my friends here developed it, and he said it costs 35 lakhs per month. And I have several patients on that back home, and I didn't even realize it is that expensive, right? So even in US, that's a lot of money. A lot of people cannot afford that kind of money, but insurance pays for it, so it doesn't stress us.
Okay.
And that is a big issue, I think, the difference. Whereas here, you have all these amazing treatments, but how many patients will
People
be able
don't invest much in
invest
health
much in
insurance.
health insurance, right?
Okay.
So
Suppose let's say a young doctor want to move abroad. Maybe MBBS complete or MBBS MD complete. What is your advice towards them?
well, if one, you should have a strong passion for whatever field you are going for. You need to have good mentors. Mentoring is important. Find a good mentor in your field of study. If you want to do, say, oncology, find a mentor here, find a mentor in the country you want to go, and do something in that field. Like, you need to show aptitude, real aptitude. Do some research if you can. At least, show some actual true interest in the field, which will come a long way in terms of course, apart from all the usual exams and all, those are important too.
Okay.
Yeah.